Thank you, the team, Unite team, to bring up this very pertinent topic for the discussion. And there was wonderful opening remarks by Dr. Lushika Jichu also. And we had a wonderful presentation from Dr. Nobert, having the South African experience. I'm having slide have been shared with your team. I will request if you can put the slide in the presentation mode, and then I will take through the what we are doing for India when we are considering the youth mobilization and advocacy program. So my presentation will be taking initial few slides will be taking the glimpse of where India is standing as per the TB burden is there and what exactly we are doing, and then for the youth mobilization and advocacy, literacy, IAC activity, how India is going forward and delivering some activities. So some glimpse will be there of those ideas and activities which we are being delivered in India. Next slide, please. So, being the larger geography, we are having a contribution of tuberculosis. This is as per Global TB Report 2025. We understand that almost 25 to 30% of TB cases, the mortality, MDR TB incidence belongs to Indian contribution as far as the global load of these situations are seen. But we are doing good in the HIV TB incidence where it is only 6% contribution over this HIV epidemic is in all over side in the declining phase. So because of this, we are in good position where HIV TB incidence is not on the higher side. If you want to see the progress of the indicator against as per our SDG targets are there. From 2025, we have 2015, we have reduction of 21% in the incidence rate, though we need to reach at the 40%. And then in mortality, if you want to see, we have reached from a 25%, which were at the baseline in 2015 to 21 per 1 lakh in 24. So you can understand that there is a 25% reduction and 21% reduction in the incidence and 25% reduction in the mortality. So it is a significant reduction as if we are comparing with the global reduction. Incidence rate reduction is in better position when we are seeing global reduction of these rates. And if you want to see the success rate, it is also more than 90% as per 25 report. It was 53% in 2015. Can we have the next slide, please? And definitely our domestic budget, previous slide, please. So when we are having many countries in the world still they are depending more on the global funding. We have increased our domestic funding part and more than 90% of our TB program budget is from the domestic fund. So this is another significant achievement from our side and commitment where government is committed towards elimination of the TB from the India. Next slide, please. So this is showing the progress over there, how the missing cases has been reduced. You can understand in the 2015 it was near about 1.5 million cases were missing, and now we are left only with near about only 100,000 cases in 2024, which are missing against the target. The blue light blue line is the global estimate as per estimate for India as per the global TB report, and this darker blue violet color line is achievement which we have achieved over the year. Next slide, please. So we are adopting the scientifically approved and the latest regimen which has been approved and globally being practiced for the DSTB, MDR-TB, pre-XDR, XDR, H monopoly. And in his presentation, Dr. Nobert was mentioning that how the BPLM is being given in the South Africa. In India, in 1 year, we have crossed almost 21 MDR-TB patient has been pushed on the BPLM, and accordingly, we are seeing the greater success rate is there. If you can see in DSTV also from 81% success rate, we have moved to the more than 90%. In H monopoly regimen also from 72%, it is near about 87% progress has been there in success rate. And if you want to see in the MDR TB, Initially, it was 50%, near about mortality was there. Now, treatment success rate in MDR TB is also near about 75%. And similarly, pre-XDR cases, which are more difficult to treat pre-XDR and XDR TB, we are having a significant good result and success rate in these pre-XDR and XDR tuberculosis, which are nearing about the 70% in the pre-XDR, and in XDR TB also it is more than 50%, which is most difficult type of MDR TB. Next slide, please. So as it was mentioned earlier in the opening remarks and the earlier presentation, why this social mobilization and IC activities are important. It is not only for the empowering the community, but for the service provider also. If you are having the right kind of IC material delivered to the community, not only it empower them to identify their early symptoms, then to seek the healthcare services, but they also provide supporting hand to the persons who are suffering from the tuberculosis. It is also a very strong tool for the stigma reduction. We understand that TB still is carrying a very high level of the stigma in the community, and if we are not empowering them with the proper knowledge, then the either TB patients are isolated and their suffering are not understood. And after this discrimination, patients are isolating themselves. They are not revealing their information, and they secretly may transmit the disease to other person also. So that is why this disseminating information to community level is very important. In India, we are having Ministry of Youth Affairs, and we are having My Bharat government portal is there, where we are having this education of the youth and developing the skills, their social mobilization and skill development, how they can not only empower themselves but can contribute to the community. So under that, we have engaged the Indian youth also. In India, 65% of Indian population is contributed by the youth, and they are very highly connected with the social media, community networks, university, youth groups. And in India, we are having multi-sectoral engagement with the program, where not only like using these social media and the main media, print media, or the video media, we are using their educational system also, where the communications and the right information is provided through the school educations, and the college level health education activities are being conducted. We are having innovations in communication, volunteerism, and grassroots mobilization. Uh, Under the NTP youth engagement platform, what we are having the TB survivors, and these TB survivors, we are giving the trainings, and we are converting them to the TB champions, so that they can come forward. And because they are from the same community, when they are coming forward and they are giving the communications to the TB patients, it becomes more effective, and a community are more receptive, because they understand that these are the sufferers. And because of this, and in India, you can understand, we are every year new TB champions are being enrolled and engaged. And currently also we are having more than 50,000 active TB champions are there, who are going to the community and providing the community services and supporting many TB patients. Similarly, youth volunteers, we are having Nikshay Mitra initiatives are there, under which the community is coming forward, and they can provide the some nutrition supplement also. They can provide the vocational support, and along with that, they can provide this moral social support also, where they can come forward and be a part and stand with the TB patient, and not to promote the this discriminatory activities, and they can forward and they can stand, yes, you are not having this very serious disease, and we want to give the support. So moral support. So Indian youth, we are not only requesting them for the nutrition support, but if they are not in position to provide the nutrition support, we are making them as a Nikshay Mitra. The training are being done through this My Bharat Gov portal, and how they can come forward, and if they are not able to provide this nutritional support, how they can come forward and can provide this moral support. So this moral Niksha Mitra concept has been developed recently, and it is being utilized to provide this particular support. And we are having under this My Bharat government, we are having a national services scheme, and we are having a national credit code. Students are also there, which are there, and these are also being utilized for this Nikshay Mitra and the social mobilization activities. Next slide, please. So here has been the commitment from our highest executive and our Prime Minister is regularly having the supervision of the programmatic activity, how the TB program is delivering. And he is having a special recommendation that youth are to be involved at each level. We are using our elected representatives also, Panchayati Raj institutions, and every level of stakeholders in the country are part of our TB program, where we are doing multiple activities. Like recently our honorable health and family welfare minister had a meeting with the 10 high burden states, and the elected members, the member of parliament, were sensitized how they can carry these advocacy activities in their elected and geographical area where their constituencies are there, how they can deliver. You can understand we are using all kind of social media. It may be main media or social media, like it may be print media, it may be TV sports. We are having both channels are there. Not only that, we are using this radio medium also to have this dissemination and conveying the appropriate message. Then we understand that youth usually goes to the movies also, so we are having special weeks were made where these important messages were displayed before the movies were started in the cinema hall, and some important weeks were also taken, like pre-independence and after independence, and pre-Diwali and post-Diwali weeks were there, where the special these messages were displayed in the cinema halls. And our team is regularly having the monitoring of the daily activities of the IC, like how many print media messages are there, how many social media, it may be Instagram or the X or whatever media is there, how many posts are there. So daily review and monitoring is being done by the program also to have the keywords, how these advocacy activities are being taken. Next slide, please. So another, as I mentioned, that in Jan Bhagidari, it is we want to have every aspect of the community which can come forward. It may be elected members, like it may be elected members in the central government, it may be in the state government, it may be in some councils. So we are approaching them, and to have the advocacy activity. Then we are involving the youth also. We are having some other campaigns, like Swachh Bharat Abhiyan is there, which is being it is a campaign about the cleanliness, and we have integrated with this program, so that anti-spitting campaign are being done through this, so that air transmission of the tuberculosis may be prevented through this campaign. So we are leveraging on that. And as I mentioned earlier, we are having a Panchayati Raj institutions where we are using a different media, and we are giving the message how the treatment, adherence, and social support can push towards our TB elimination. Then we are having communication campaign focused on the cleanliness and TB preventions, which are being disseminated through TV media and the radios also. And then we are having integration with other national programs, like we are having HIV program, where the messages are being integrated with the substance abuse, generating awareness about the TB. Stigma reduction is over one of the main campaign, and along with that we are having some IC activities which are towards the case identification, treatment adherence, and then how we this youth can come forward and contribute towards the support to the TB patients in moral way. Those are there. And definitely we are having different occasions where we are having special fair and festivals are there, and special campaign, like be it a Republic Day, be it a Christmas Day, or be it a big Hindu festival or any festival. So we are not living any such activities where we are giving these advocacies are not being done. Like we are having every year the trade fair is there, international trade fair, and we are having a special booth is there for the TB messaging. Street plays are there. We are having a different kind of activities which we are doing at these activities. Next slide, please. So these are some of the display of the activity, some of the examples. If I would have taken, I would have taken almost 100 of slides. If I would like to, these only some examples how we are doing. Like you can see, some trade fair activities are there which are being held, and then youth activities are being depicted in this picture, where our program officers and representatives are there, and the communities are also involved in these activities. Next slide. So this was about some of the advocacy and IC activity which are being implemented in India, and how we are doing activity. So I hope I have communicated some of the new idea which may be replicated by other countries also. Thank you very much, and thank you for giving me the platform to make this presentation. Thank you.